The following is a paid promotional announcement for the Dunes Eye Consultants Dry Eye and Tear Film Center of Excellence in Dakota Dunes. With breakthrough LipiFlow technology, Dunes Eye can treat the underlying cause of dry eye disease and provide relief to patients quickly.
We have a unique standard of care.
Instead of treating symptoms, we treat root cause.
My eyes don't decide when it's quitting time anymore.
Dry eye is the most common medical eye problem encountered by eye doctors in the world. It's a result of having tears that are not normal. Tears have two critical functions. One is vision, and I think patients and even many eye doctors don't understand the value of the tears as it relates to vision. It's the first refractive surface. It's the first lens. And second, tears support the surface health. The surface of the cornea, for example, has no blood, so it relies on absorption of the tears for nutrients and to fight infections and to fight inflammation. So tears are complex, and they're also a critical part of our visual system. So when the tears are not normal, it starts to create symptoms. Classic symptoms of dry eye are first feeling gritty, burning, blurred vision that is improved by blinking, sometimes itching. Those are really common signs. Then we start seeing light sensitivity as it progresses, discomfort, pain, foreign body sensation, and then of course the redness and unhealthy looking eyes. Obviously, redness is a sign of inflammation, and it's a sign of having most likely abnormal tear function and tear quality.
The percentage of people that come into our office with dry eye signs or symptoms is, I would say, minimum 1 out of 4, and that may even be on the low side. Now, not everybody has symptoms, but that's why we do screening tests early to help find signs before people complain. And that allows us to pick up dry eye or ocular surface disease in the beginning stages.
The result of having abnormal tears is inflammation of the surface of the eye, and that's called ocular surface disease. And the longer that it's there, the more damage that it will do. Left untreated, dry eye can progress into serious ocular surface disease, resulting in loss of vision, pain, patients are debilitated, they can't work. We want to intervene as early as possible. When we're talking with patients about the treatments that they're doing for their dry eyes, they tell us about supportive therapies, such as artificial tears, warm compresses, and lid margin treatments often make patients feel better, but do not directly affect the underlying cause of the problem. So over periods of time, these supportive therapies tend to be less effective, and they allow the disease process to further progress. Over a decade ago, the standard approach to treating a patient with dry eye was to manage their symptoms without fully understanding or attacking the root cause of the problem. Today, our science-backed research and advanced technology have changed our entire approach to managing tear film abnormalities in dry eye. We understand the mechanisms that cause disrupted tears and dry eye, and we have the ability to fix those problems. It's kind of like going to a leaking pipe. We can fix the pipe versus just mopping up the flooded water. It's really changed our approach. Instead of treating symptoms, we treat root cause. One of the big breakthroughs of understanding in dry eye and tear film was how influential the oil of the eyelids is to stability. The meibomian glands of the eyelid produce oil, the most important part of the tears. 86% of patients that have dry eye have abnormalities to these oil glands. And by treating those oil glands, optimizing the function, making sure that oil is normal, you create like a saran wrap for the surface of the eye. It is incredibly important that that has to be addressed on every single patient. We use diagnostic technology on all patient experiences at our office. We scan the meibomian glands using 2 different types of technology, LipiView and LipiScan. It gives us a picture of the glands to determine architecturally, are they normal? Are we losing glands? Because if there's blockage, they can die and atrophy. We can predict if a patient's going to have a severe problem. We can also identify if they have obstruction. And so it's a quick assessment that gives us a lot of information as we start our evaluation. Utilizing LipiFlow technology is very fundamental. It is the gold standard of care for meibomian gland disease, which meibomian gland disease is present 85 to 87% of all dry eye patients. LipiFlow is a very straightforward procedure. It's vectored thermal pulsation. It affects every single gland, which makes it unique in technology, and it's designed to warm the eyelids internally, to loosen up the oil, and then the thermal pulsation removes the obstruction. The key is removing obstruction. Once the glands can flow, they have a chance to rehabilitate and improve the quality of the oil being expressed. The treatment LipiFlow was developed in conjunction with Duke University, and some of the top ophthalmologists there in association with Dr. Donald Korb, an optometrist from Boston who understood meibomian gland disease and realized that we had to have a treatment for it. It was not long after that we brought it to South Dakota, the very first center in South Dakota to offer LipiFlow. And as they helped support my practice, we learned how to implement the technology in our practice eyes, I became a consultant for them. And then we had other doctors from around the country fly in to observe, shadow us, and learn how to provide more effective treatment plans for their patients. What really makes us comfortable in using LipiFlow is it's FDA approved. Not only FDA approved, but supported by research. So you have two things: an FDA regulated device that also has 32 peer-reviewed double-blind scientific studies to support it. That makes me feel very comfortable when I treat patients. The LipiFlow treatment is often equated to like a spa treatment. Marcy, our dry eye specialist, uses that term a lot. And it is. It's very soothing, it's very relaxing, and in almost all cases, patients receive immediate comfort after the treatment. It'd be very rare for a patient not to have a very enjoyable experience.
I started to notice a problem while wearing contacts. I was experiencing a lot of discomfort, especially around the end of the day. Some days they'd be dry and itchy, but other days they'd just be watery. There was some fluctuation in my vision, and things didn't look as sharp as they did when I was wearing my glasses. Sometimes I'd have to call it a day because my eyes would get really tired and I just didn't feel that good. If I was outside and it was dry and windy out, my contacts would just really start to bother my eyes. But I think I would experience most of my symptoms while I was looking at my phone or working on my computer. I'm a college student and a video producer, and I spend a lot of time working at my computer. So I wanted to find out what was going on before it became a problem.
The importance of treating dry eye, and especially MGD at an early stage, is it allows us to preserve the glands in the ocular surface and allow them to keep their tear film healthy for the rest of their life. Untreated dry eye disease can lead to not only further in symptoms, but also can start causing corneal changes, as in ocular surface disease, unhealing defects, and a lot more symptoms as the disease progresses. This is why we try to not only diagnose but treat at the early stages and not just late stage dry eye.
After talking with Dr. O'Neill, I learned that dry eye can actually get worse and worse over time. I felt it was really worth the investment to have this treated.
After LipiFlow, a lot of patients actually come in and they notice not only are their symptoms improved, their vision can actually be improved. The first line of vision comes from the tear film. Without a healthy tear film, a lot of people don't see well. Their vision can fluctuate throughout the day. They can notice their vision is clearer in the morning than the evening, or opposite. After LipiFlow, a lot of times it is improved.
My vision stays sharp now from the moment I put my contacts in until I take them out at night. Now that I'm treated, I don't feel my contacts anymore. I can be more productive at the computer now until I'm ready to call it a day. Thanks to Dune's Eye, my eyes don't decide when it's quitting time anymore.
We have thousands of patients that have been treated here with outcomes that have changed their lives. LipiFlow results are typically optimized at approximately 6 weeks post-treatment. Now, there can be some variance depending on the severity of the disease, but we see patients really starting to feel their best somewhere between 6, maybe even 8 weeks. Meibomian gland disease is an interesting problem because it's not defined by just one subset of a problem. It's multifactorial, and meaning that there are different types of patients that have different causes of their meibomian gland problem. The average patient should expect a 3-year window of good benefit from a LipiFlow treatment, although patients may need it more often depending on their individualized problem. Maybe what's made us more effective in our treatments over the past decade is understanding that LipiFlow is just the beginning.
We know LipiFlow is really the gold standard, but it's not the only treatment for people with meibomian gland dysfunction.
LipiFlow opens the glands up, expresses the glands, but then it's up to us to determine if the oil production is of good quality, and if it's not, we need to rehabilitate that. We may need to use medication in a short period of time. We obviously like patients to be on some sort of supplement to maintain that health.
We work on eyelid hygiene. There's a lot of ways to treat it to help improve the oil of gland expression and also help prevent further atrophy. LipiFlow is not the only treatment option.
We like patients to blink. Blinking is critical to activating the glands, keeping them open and keeping them functional. Post-treatment is really critical, and that's one of the keys of having a dedicated dry eye specialist to support that post-treatment to ensure we're getting an optimized outcome and really respecting that investment that patients are making in their dry eye. The Dunes Eye Consultants Dry Eye and Tear Film Center of Excellence has grown out of a need to serve patients. And we use the term Tear Film Center of Excellence because the tear film is very complex. It's made up of various components, and therefore it's not necessarily just dry eye. You can have abnormal tears without dry eye symptoms, but those abnormal tears can create problems. So we needed to blend the terms dry eye and tear film together to give a more effective meaning to what we actually do. And our results are very targeted at tear film change, resulting in improved dry eye symptoms. Because dry eye is such a prevalent problem and so foundational to how patients function with glasses, contact lenses, and LASIK surgery and post-cataract surgery. It becomes almost the focal point of the evaluation. So therefore, if we're going to manage this condition properly, we have to have a dedicated team to assist us because many patients have it, and it's not a straightforward treatment always. There's multiple factors that can play into the treatment. So therefore, you have to have an appropriate, well-trained team to support it. Marcy Rich is our dry eye specialist. Now, Marcy is unique in the fact that she has been in the eye care world for almost 30 years, and therefore she has a tremendous amount of experience. She's been in all parts of an eye care practice, surgical, optical, clinic. She's really an expert, and she functions as a support person that really can help the patients understand their disease, help them understand their treatment, and helps coach them to the end point of a successful outcome. The reason that we decided to launch the Dry Eye and Tear Film Center of Excellence is that we felt very committed that we now had the solution patients were seeking. One, we have experience. Number two, we're following the standard of care.
At Dunes Eye Consultants, we have a unique standard of care. We perform ocular surface imaging on all of our regular patients when they come in for their exams. It allows us to get a good understanding of their tear film, even if they're not symptomatic. We believe this is super important, even in regular patients.
When we identify a patient that has what we call subclinical dry eye, we're seeing evidence of disruption or abnormalities to the tears but without symptoms. We really like to educate the patient because we know it's going to progress. It may progress to the point that a patient has visual changes, can't wear contact lenses, and then of course the symptoms can mount. More disturbance during the day, more need to grab an artificial tear to feel better, and then the cosmetic influences of redness, irritation. So it's a progressive problem, and it's best once again for us to consider treating as early as possible. When a patient calls us and says, hey, I need to come in and have LipiFlow, we don't automatically book that because we don't know for sure if they need it. There are those patients that only have a small volume of tears, but their oil glands are functioning beautifully. It's just that their tear film is too skinny. And by raising that tear film within a treatment such as a punctal plug to stop the outflow, we've effectively managed that in a very efficient way. The workup is critical. Many patients have both forms of dryness. They have abnormal gland functioning from their meibomian glands and low volume, and we often have to combine therapies to get the best outcome. The paper that we published, The Pyramids of Dry Treatment and Tear Film Reconstruction, was a result of a need. There was not a really good clinical approach to how to manage a patient with abnormal tears and dry. In collaboration with my son Tanner, who's an ophthalmology resident at Cleveland Clinic right now, he helped and assist me in building this model. And what we do is we address factors that could influence having abnormal tears. Then we use the diagnostic workup, state-of-the-art workup, to overlay that. And from that, you build your next phase of the pyramid, which is choosing building blocks to treat that patient in each one of those foundations. If you miss one, you've got a weak pyramid. So that's why we built this model. We have to address every one of those important factors and then have an overlying foundation, which is the workup, to then apply appropriate treatments to get to the top of that pyramid. Over the last decade, we've treated thousands of patients for tear film, dry eye, and ocular surface disease, and nearly 2,500 eyes have been treated with LipiFlow in our office. So we have a very good understanding, and we're subclassifying that understanding every day and improving with each patient we see. As a dry eye patient myself, it's nice to not have to depend on prescription medications, artificial tears, other means of trying to support my symptoms. And many of our patients get to that level by reconstructing the tear film. In our approach, using our pyramids philosophy, we're able to get people to allow their own tears to take care of the health of their eyes versus something artificial or medication. Let's give your tears a chance, but we have to make them correct. That's the ultimate goal for a patient.
The preceding was a paid promotional announcement for the Dunes Eye Consultants Dry Eye and Tear Film Center of Excellence in Dakota Dunes. With breakthrough LipiFlow technology, Dunes Eye can treat the underlying cause of dry eye disease and provide relief to patients quickly.
We have a unique standard of care.
Instead of treating symptoms, we treat root cause.
My eyes don't decide when it's quitting time anymore.
Visit duneseye.com or call to learn more.